Wonderful. Well, welcome everyone. My name is Dr. Fiona Godley. I'm a former editor-in-chief of the British Medical Journal, and I'm an ambassador for the UK Health Alliance on climate change, which, just briefly to introduce it, is an alliance of 42 health organisations in the UK, including all the major royal colleges, the BMA, the BMJ, the Lancet, a number of august organisations, and it represents over 1 million health professionals in the UK, and campaigns for a fair, sustainable and healthy world. So today we're very delighted to be speaking to Baroness Brown, Julia King. Baroness Brown speaking from Cambridge. And just briefly, if I may, Julia, to a quick summary of a few elements of your august career. Previously chair of the Carbon Trust, Vice Chair of the Committee on Climate Change, and Chief Executive of the Institute of Physics, and now Chair of the Adaptation Committee in the speaking from the House of Lords. And I'd really be grateful, Julia, if you could start by telling us what is the work of the Adaptation Committee.
Certainly, yes. The Adaptation Committee is part of the Climate Change Committee. It was established by the Climate Change Act in 2008. And the Climate Change Act actually established two committees: what is generally referred to as the committee, which is the Mitigation Committee, and also the Adaptation Committee. So we are made up of a chair and 5 independent experts, and I'm the chair at the moment. Until a few years ago, one of our independent experts was Professor Dame Anne Johnson, who I'm sure many of you will have come across, who took a really strong role in our health work. When Anne had to step down because she'd served 2 terms, sadly, we acquired Professor Mike Davies from UCL, who covers the sort of buildings and health agenda, and works very closely. He's himself a building physicist, but he works very closely with the medical community at UCL. So that's how we keep our kind of expertise on the health side at the moment. When Mike comes to the end of his term, we may go back to having somebody from a health background. With only 5 experts on the committee, we all have to cover quite broad areas. But our other experts are in the areas of flooding, the natural environment, climate finance, climate adaptation and business, and as I say, Mike Davies in the area of buildings and health at the moment. That's how we're currently constituted. And I'm an engineer with a materials and mechanical background. So our role is to support the government in producing its 5-yearly climate change risk assessment. So we did that relatively recently, publishing our advice to the government on the 3rd climate change risk assessment in 2021. And the government published its final climate change risk assessment early last year. The production of the climate change risk assessment, the work we do on the committee is that we pull together the academic community to look at all of the academic evidence about climate risk and about the effectiveness of adaptation measures, to then try and get a picture of what the residual risk to the UK is. So where does the government, should the government be acting? So the Climate Change Act, after the government has presented to Parliament its climate change risk assessment based on the work we do for it, then the next year it has to publish its National Adaptation Plan, which says what measures is it going to take over the next 5 years to address the climate risk. So that's called the NAP, typically, the National Adaptation Plan, and that was published in July this year, just as Parliament was going into recess. So possibly didn't get as much publicity as it should have done. So our role then on the committee is that we monitor the government's progress in delivering the NAP. So our 2 important roles are preparing the climate change risk assessment and giving the government advice on it, for them to publish what they think is their definitive version. And then after they've published the National Adaptation Programme, every 2 years we monitor what progress they are making in delivering it. So it's a little bit like the role of the mitigation committee, only it's rather more difficult because we don't have those specific targets to monitor progress against. And one of the things we're continually trying to do is push the government to set very specific targets for adaptation, to tell people what a well-adapted UK should look like, and then set itself targets for progress towards that. And
I presume also getting government to commit to putting money, hard cash, behind making changes. I mean, we're in the midst of the concrete crisis in schools, and I guess forward planning of that sort is always easy to cut out of budget when we're under budgetary pressure. So how do you hold account in that respect?
But we sort of feel that if it would set specific targets, then the money would follow. But because it makes very general statements. I think the most recent National Adaptation Plan says the UK will be well adapted to climate change. So, what does that mean? You need a flow down of that means this is what people can expect.
Yes. So, I mean, I understand you've been quite critical of government over the years, and have earlier this year said that we had a lost decade in preparing for and adapting to climate change. Could you perhaps give us a sense of how badly you think we failed so far, and where we failed as a country?
Well, it's a lost decade because we had the first, that was sort of when we were publishing the third climate change risk assessment. So it was 10 years from the first one being published. So 10 years when we might have hoped to have had some focus on how we needed to adapt. And I think last year was in some ways a rather dismal example of how we failed, because we had, as people remember, we had record-breaking temperatures last summer. We have been saying for the last 10 years that we needed to ensure that new homes were built to standards which took into account overheating, because we know our summers are going to go on getting hotter, and we already know that a very high proportion of homes in the UK overheat. It has taken us 10 years to get the government to agree, and they have now finally done that, to change building regulations so that new homes will be built taking into account overheating. So we've had 10 years of building new homes when that could have been happening, and it hasn't. And there are still no provisions for helping people in existing homes to adapt their homes to climate change. So, whilst people are being supported to put in heat pumps or insulation to help with mitigating climate change, at the same time, we should be offering them support to put in whatever it is, external shuttering, better ventilation, some of the other measures you can take to protect your home against overheating. Or indeed, in some city centres, we should be offering people subsidies on reversible heat pumps so they can use them for air conditioning, where really temperatures get too hot in the summer for just types of shading and ventilation to be adequate.
So those are examples of how we might catch up, I guess, and how
that's just one of the areas, if you like. The other one I'll flag up, of course, is that in the end of 2021 and the beginning of 2022, we had a series of very severe storms. We had Storm Arwen, which left people in the north of England and Scotland, some of them without power for up to a week. Now, as we move towards a decarbonised world where our transport will be electric, our heating will be electric, of course our lighting is electric, our communications will rely on us having an electricity supply, in order to charge our phones or use our computers or whatever. Not being being without power for a week will really mean your life comes to a halt. So, and what it showed us is that, we have an electricity system, we have all this infrastructure, which is not yet resilient to climate change. We have to something like, by 2050, we have to something like double, if not more than double, the size of our electricity system, it's absolutely critical that every new piece of that system that we build is going to be resilient to the future climate, to what climate change can throw at it. And, you know, we have a railway system where the West Coast Main Line from London up through Birmingham, up to Scotland, every time we have a really hot summer day, the overhead cables expand too much, the pantographs are not able to connect with them, and so our train system, our transport system fails. All of these things are things we know how to deal with, require planning and require the right investment now to make sure that we are making our infrastructure fit for the future. And we need to recognise that we saw a huge increase in heat-related deaths last summer in those periods associated with those periods of very hot weather. We know that very hot weather and very hot homes, particularly where you have hot bedrooms, mean that people don't sleep very well. We know the impacts of poor sleep over significant periods on people. You know, there are so many of these issues that we could address, and really very little has been done. We're finally seeing quite a bit of activity now, thinking about how do we make sure our electricity system is resilient for the future. That's a good thing, but gosh, you know, we should have been doing that for the last 10 years.
Let me just say to people who've joined, do please send any questions you might have via the chat, and I'll put them to Baroness Brown. I sense inevitably, and I would be feeling the same in your position, a feeling of frustration. And you know, the 2023 Adaptation Committee report to Parliament said that the next national adaptation programme needed to be more ambitious than its predecessors. I mean, given what you're saying about how far behind we are, and I guess, you know, the unwillingness, if you like, of governments to commit to specific targets, which would be then they could be accountable against. What do you mean by ambition, and what level of ambition would you like to see?
Well, what we wanted the government to do was to set out what it thought a well-adapted UK would look like. So, but then put metrics onto that, so that we, and as people and as businesses in the UK, we could understand what the government would be doing and what we needed to do to make ourselves, to adapt our homes and our ways of lives, and make ourselves as resilient as possible to the future climate. What the government has given us is a vague statement that says, you know, the UK will be resilient to climate change. We don't know what that means. Business, for example, needs to understand what level of flood resilience, for example, their critical supplies have. So what level of flood is the local electricity system resilient to? What level of flood is, or other climate hazard, is the local water system resilient to? So for what type of event can you be confident that that critical infrastructure will continue to function? And indeed, the critical infrastructure providers need to know that they are preparing for the same sorts of levels of resilience. I met a very frustrated water company boss who said he had just spent a lot of money because he had to be resilient to a 1 in 200 year flood, only to discover that the local electricity substation on which he relies for one of his sewage plants is only resilient to a 1 in 50 year flood. So, you know, he doesn't work if he hasn't got power. So why had he invested all that money in 1 in 200 when his power was not guaranteed to 1 in 200? So we need common resilient standards across our infrastructure, and then we need communication to us as citizens, as people, to understand what that means for us, to understand if you live in a flood zone, what level of protection the Environment Agency can provide for you to what kind of weather event, but what sort of extreme weather event actually will that level of protection not function? And you know, how important is it that you have your own property level resilience measures so raised sockets, waterproof plaster, solid floors on the ground floor with no carpets, so that if in an extreme event you are out of your home because of a flood, you can get back in again quickly. So, you know, we need this much clearer picture of what the government and its agencies will provide, what standards they're going to require our critical infrastructure industries to work to, and then what we as citizens or businesses need to be prepared for and to do for ourselves. And of course, all of this has health consequences. The health consequences of people being out of their homes because their homes are flooded are enormous. The levels of depression, and in some cases very long-term depression and other health impacts, are really quite significant. And in those crucial times, do we know whether the local GP surgery is flood resilient or not? Because that's somewhere that may be being particularly important for people.
I mean, the vision idea of actually starting with where should we be, and then the gap between where we should be and where we are. I mean, is that your responsibility to frame that vision, or, as you say, are we expecting politicians and governments to tell us what we want, or is it something that you know, the citizenry, if that's, or the you know, citizens, juries, or someone should be saying, this is what we want? Why aren't we?
Those are extremely good points. The Climate Change Act is frustrating from an adaptation perspective. It gives the mitigation committee the job of setting that vision in terms of setting the carbon budgets, but it doesn't give the adaptation committee the same challenge or the same power. The adaptation committee simply advises government, whereas the mitigation committee recommends the levels of the carbon budgets, which are what sort of frames the vision and the actions. And so there does need to be a process where government defines a vision. But I think you're absolutely right. Citizens' juries, citizens' assemblies would be a really good mechanism, because I think people need to understand. They need to have a view on how much change they think is appropriate, how much should they do, and how much do they expect government to do. And of course, if it's things they expect government to do, then of course we need to expect to pay for it through general taxation, for example.
I've got some questions coming through. So I'm going to start with Terry Kemple's question, which is, if government is neglecting to set specific targets for adaptation, what can the UK Climate Change Committee and others actually do to hold government to account? I mean, obviously we've got the election coming, but that may seem...
Well, of course, one of the challenging things in a way has been this third national adaptation programme has been published very close to the expectation of an election coming quite soon. And so I think you do feel that there's been a lack of focus, really, a lack of focus from the department on, and the politicians on, actually how important this is, because the election issues are kind of taking over as everybody's main focus at the moment. We continually try, although our remit is quite subtly only in holding the government to account, only in holding them to account for what they said they would do in the National Adaptation Programme. So if they set themselves a very low bar, and so far our national adaptation programmes have set themselves pretty low bars, then actually what we're asked to do is to monitor whether they're doing what they said they would do. What we do is we push rather further than that, and we monitor them against what we think they should be doing, as well as against what they said they would be doing. And that has so far been quite effective in raising the issue with parliamentarians and to some extent with the public. But of course, it doesn't give us the power that the mitigation committee do, and now the mitigation committee through the Office for Environmental Protection, who can actually enforce the mitigation targets. We don't have any power of that sort. So it is really just continuing to to talk about where things could be being done that are not being done,
Yes.
and reminding people of the data of the impacts that we're already seeing.
And just a brief follow-on question from me. I've got some others from our listeners, but I was very struck in some work that I was involved in that there is no select committee on climate change. There's no, it doesn't feel that it has, considering the enormity of the issue, it feels that our constitutional parliamentary structure doesn't really give it it hasn't got a voice in the way that other things have. I don't know if you have a similar view.
Well, I think obviously for the most part, the House of Commons select committees follow the government, follow the departmental structure. So we now do have a select committee for energy security and net zero, which follows the Department for Energy Security and Net Zero. So that's in the Commons. We also, of course, have the Environmental Audit Committee, who have done a very good job on raising adaptation as an issue. And now in the House of Lords, we have a House of Lords Select Committee on Environment and Climate Change, but that's only been in operation for a couple of years now. I think we've been lobbying in the House of Lords to say, that was something, exactly as you say, that was something that was missing from the parliamentary committee structure and that we really urgently needed.
Okay.
So I think we're a bit better than we were.
Oh,
and I would give the Environmental Audit Committee a real plug, because they do a lot of work on adaptation. They very recently done an inquiry into overheating, which I gave evidence to.
Thank you. Johan Beckford is saying, what wider enabling policy changes need to take place in order to successfully adapt UK homes at scale? A majority of people would be unable to make changes to their homes, either through a lack of power to do so, living on a leasehold flat, or through lack of finance to install expensive technologies, reversible heat pumps, etc.
Well, we would like to see adaptation integrated right across policy, just as mitigation needs to be, so that when when BEIS is thinking about how do we roll out £600,000 heat pumps and do the kind of insulation that's needed to people's homes to make a heat pump a viable option, and how do we put in place the right support for people who are from lower income kind of households, for them to make those changes, that we also need to be thinking about indoor air quality and indoor temperatures in the context of the changing climate. And actually, if people are living in flood zones, we should also be thinking of adding into that package things like property level flood resilience measures as well. So that kind of integrated thinking in terms of how do we make that support work. But also, of course, making sure in building regulations for new buildings, and making sure particularly for environments where people spend a lot of time indoors. So schools, hospitals are particularly critical. Prisons, to me, are particularly critical. That all of these buildings are designed, and that we're starting to put budgets in place for adapting existing stock to take account of much hotter summers to come.
Actually,
we have some requirements on the rented sector now, that in order to rent somewhere, it needs to meet standards for emissions. We should also have standards for overheating on properties that people are going to be able to rent out. So, just integrating it across. There's already been quite a lot of thinking about how do you do the mitigation. We need to be bringing the adaptation in as well.
Yeah. And just picking up that point about hospitals, Lauren Davis has said a hospital should be the last building standing in an extreme weather event, wildfires, etc. Should there be higher requirements for adaptation of healthcare buildings? And you're kind of saying yes, there should be.
And indeed, there is now more monitoring going on in hospitals of interior temperatures, which is something that was very patchy, and we have been pushing for a long time. And there are now standards for new buildings, as there are for schools and prisons. But again, actually, of course, it's our existing building stock that's the problem. And of course, we have lots of 1960s and 70s hospital buildings with big plate glass windows, many of which are now bolted shut. And so the ventilation issues that in some wards that gives rise to. And indeed, during the heat wave summer last year, we had some areas where 20%, there was reported 20% of operations had to be cancelled because operating theatres were overheating in our hospitals. So we have to have an environment where we can continue to operate in the weather and the climate that's going to come.
Our way. Neil Cartwright asked, which countries are doing well in adapting to climate change? I mean, we all have the ones we assume are doing well, but in your experience, where is the best progress?
I don't have. I'm afraid I don't have. I have quite a lot of information about the UK, and I don't have a huge amount of information about globally. Clearly, we know that countries that have experienced severe weather events much more frequently than we do in the UK. So places like Japan, where they're used to typhoons and things, that people know how to behave and they know what to do. And you see people boarding up the weather's coming, people are boarding up their windows, they bring in all the things from the plants from their steps, they tie things down. And then when the weather has passed through, they come out and put everything back, and they know how to deal with that. We see some of the lower lying island states where they're now seeing really severe flooding problems. They have now, in many of them, have got very good early warning systems, and we know that people really respond to those because they understand the implications of not doing so. So, we have a good flood alert system in the UK. Most people who live in flood risk areas are signed up to it, but not everybody yet, because we haven't yet got that into our psyche that we should all know whether we live in a flood risk area, and we should all be signed up for flood alerts. And indeed, we've now started getting heat alerts as well. So I think there's different bits of good practice and different things for us all to learn from each other. And I think in the UK, many people look at us and say, well, you probably have the best piece of legislation and some of the best process, but at the moment I don't think we're making it work as well as it should.
It's bringing us back then to the UK, but the four nations. This is my ignorance. I don't know how is that devolved? This is mitigation and adaptation devolved, and how
it's devolved, yes. And as of this year, we now do support all of the Northern Ireland, Scotland, and Wales. Scotland have for quite a long time had their own adaptation programme, and they ask us to report on their progress. Wales are slightly newer to it, but they have the advantage of the Wellbeing of Future Generations Act,
yes,
which gives them a context for doing of all these things. And we now report regularly on Wales's progress, and Northern Ireland have just asked us to do assessments for them, having just got their Climate Change Act recently in place. So we do now report for all four nations. We do now do assessments for all four nations, and they're at somewhat different stages of maturity. I'm
very interested to hear your thoughts on the current political environment. I mean, it seems to sort of it's a bit of a roller coaster. I think most people would agree. And we've got the election coming. Party politics may not be the right moment to talk about that in more detail, but there's a question about this as well from one of our listeners: is which parties do you feel have really got their shoulder behind this and have really understood the urgency and are in their manifestos, as far as we can see, are willing to really make this an issue for the next election?
I think I found it slightly frustrating that there's a lot of focus on mitigation, and rather less focus on adaptation. So I would say I don't think. I mean, I suspect probably the Green Party is the one party that has a very clear focus on this. I think the other parties find adaptation is difficult. It's not as simple it's not as easily measured as mitigation. And I think all the parties are struggling with where do you put it. At the moment, it all essentially reports in through DEFRA. The challenge is that DEFRA is not one of the powerful departments in any government, and you're trying to, DEFRA trying to marshal its colleagues in Department for Transport, in the Business Department, in the Energy and Net Zero Department, in the Department of Health, is not generally terrifically effective.
Is there an issue of literacy? Johan Beckford's asking about that, adaptation literacy amongst politicians. Is that an issue that needs addressing?
Absolutely. Adaptation awareness is very much something that needs addressing, but also recognizing that net zero doesn't solve all the problems. We desperately need the focus on net zero, so not in any way wanting to lessen that focus. But even if we're on track to net zero globally, then we will still be seeing probably about 2 degrees of warming by the time we get to 2050. We'll certainly probably be seeing, we're probably going to be seeing 1.5 degrees of warming by the early to mid 2030s on the track we're on at the moment. That means that a heat wave summer like 2018 or last summer, they become typical. It means by the 2050s we could be seeing maximum temperatures of over 40 centigrade if we follow the track that we're on at the moment in the UK. So people have got to recognize that the climate goes on changing quite rapidly until we reach net zero. And so if we don't reach net zero till 2050, that's almost it's more than another 25 years of climate incidences getting worse, of heating getting worse, of flooding getting worse, of more severe wildfires, of more severe droughts. And so we've got to do net zero, and we've got to prepare for quite a lot more severe climate change to come.
Just moving on to the health side of things, since a lot of the effort that UK Health Alliance on Climate Change and the BMJ has been trying to bring climate change into the mainstream for health professionals and trying to give them a sense that this is part of their job to advocate and to talk about and to help to tackle climate change as public health physicians, which at one level all doctors and public health clinicians, all nurses are as well. What is your sense of the current state of understanding about the health implications of climate change, and how important is it, do you think, as part of alerting politicians and the public more generally to that being a major part of the conversation?
We've certainly on the Adaptation Committee had a lot of interest from health groups to find out more about the impacts of climate change. So a lot of interest in the risks to health and well-being from high temperatures, which is one of the risk areas we identify in the climate change risk assessment, and also the knock-on risks that you get to air quality, both indoor and outdoor air quality from those periods of very high temperature weather. And of course, we know that air quality is one of the biggest public health challenges that most countries have, and certainly one that we have in the UK, with high temperatures really exacerbating air quality problems in our towns and cities. I think we're getting more awareness of every day, actually, of the risks to health from new pests and diseases. So people will probably have read in the papers last week about the fact that they're now spraying parts of Paris against tiger mosquitoes, potentially spreading Zika virus and dengue fever. That's something they've experienced now in Germany, in Switzerland, in France. It's not going to be long before we see that. We've seen increases in Lyme disease, which is a climate-driven effect. So there are all sorts of risks to health from vector-borne diseases that we need to be doing monitoring. We need to be aware of the kind of impacts of climate change on disease and health overseas, things that could be coming into the country. We're seeing more and more periods of drought. We had some periods of quite extreme drought last summer. So we've got coming the risks to health from poor water quality and potentially water supply interruptions that come from very low water levels. So, you know, lots and lots of things that we need to be aware of. And also generally making sure that the population are aware of the things they can do for themselves, making sure elderly people are aware that, you know, it may well be better to shut their curtains and keep the heat out during the day, and that they may need to drink plenty of water in warm weather. Making sure people have that sort of general knowledge about how to manage themselves and how to manage their welfare during hot periods, I think.
Yes, and Lauren Davis is saying about the fact that these health impacts fall disproportionately on those who are, you know, less advantaged.
Disadvantaged.
More
Absolutely.
disadvantaged.
Lots of evidence.
Specifically says, do we need a cross-government, cross-department action on this, similar to the mitigation strategies to reduce the risk and tackle these inequalities? I think that's in terms of the health impacts of climate change, but maybe we have got inequalities cross-government action, I guess, have we? Or maybe not enough.
I think it's one of those things that also government need to be giving local government more funding to deal with, and giving local government more ability to spend the funds they get for dealing with climate change issues in more flexible ways, because we're seeing more and more use of sort of geographical data sets, you know, superimposed on each other to give you enormous amounts of information on things like where locally are going to be your hotspots of sort of deprivation, of particularly high inner city temperatures, of areas of a town or city where there's a lack of outdoor green space. So you know, at a local government level, you really can start to see where where you would prioritize investing money. Where do you have concentrations of old people, of low income, of people living in flats with no outdoor space? These sorts of concentrations that tell you where you're going to start to have problems first, and where you should be spending money.
Oh, it does. So much of this does come down to money, doesn't it? We've got local councils going bankrupt, and they're stretched in a million ways. I guess the problem with climate change, both mitigation and adaptation, is that it always still seems a long way off, or it seems to be something that people can close their eyes to because it's not, you know, doesn't seem to be affecting people immediately now. But I guess, you know, the current heat wave and you know, other immediacy factors will shift that over the next few years. But
I think we've started to see
we need to make the changes now. So where would the money come from that would fund local government or national government or to do the necessary things?
Well, we have to prioritize what we want to spend our money on, don't we? And how we redistribute funding from the more affluent to the less advantaged. I think it's
yes, and that becomes a kind of political ideological view about, you know, low tax, high tax government, doesn't it? So I suppose, yes, we need to wait for the election to see what the populace think on those matters.
But I think that's also why your suggestion of, is this something we need to do with citizens' assemblies, to get people talking about what do they expect? You know, are they really not wanting a world where actually nothing is different from today, in which case there's an enormous amount we need to spend on adaptation? Or are there measures that things that people will think is acceptable, and changes that they think they can make that can help the government think about, therefore, what does it need to do and what's it going to cost. People need to be having those discussions. And
I think I'm right in saying that when you do ask citizens to do that, they're always much more radical and willing for change than governments believe they will be. Rather like we found with COVID, that people were willing to take the sacrifice of staying at home, when governments felt they wouldn't be willing. I mean, is that your sense that
well, certainly with the Citizens' Assembly on mitigation, people, yes, that's something the Climate Change Committee has used in terms of the behaviour change that it sort of that it feeds into its pathways for reducing emissions, because it gives you a kind of range of things people are prepared to do, and they are probably more extreme than government thinks they are. Yes.
And Terry Kimpel says, I can hear Terry. I can hear you saying this, Terry. We had a citizens' assembly in 2020, but nothing happened. So I guess the citizens' assemblies have no statutory power, obviously.
Well, I think things like the fact that we have the on the mitigation side, the fact that we have that we still have the ban on sale of fossil fueled cars and vans coming in 2030. That was one of the things that actually the Citizens' Assembly reinforced that people were prepared to do. That they were prepared to. They wanted to be able to use private cars, but they were prepared to change their cars.
So effectively giving courage and headroom to politicians.
So I think it has given, in some of those areas, absolutely the courage and headroom to politicians to stick with some of those targets, because there is quite a lot of pressure for them to weaken that target, and we haven't seen that.
Where do you see the role of activism, Julia, in all of this? I mean, activism is a broad term, and there's non-violent protest and that sort of thing, and then there's the more radical end of it. Do you feel, what is your sense of the importance of body groups like Extinction Rebellion and Just Stop Oil and Insulate Britain in shifting the political and public mood?
Well, I have a lot of sympathy with obviously their objectives, and indeed when the around the time of the net zero, the legislation for net zero in 2019, we had Extinction Rebellion very active in Parliament Square, and at that point, and in central London, and at that point, I think they were actually very effective in raising the profile of the issue, but also they did it for the most part, in a very gentle and rather positive way. There were lots of people wandering around handing out pieces of paper apologizing for causing inconvenience to passers-by and things like that. And there were things that I think people found quite human and quite appealing about the way they did it. And whilst I absolutely sympathise with the Insulate Britain's objectives and things, I do think when you start to cause real distress to people, you start to lose them. And I think some of the more extreme things we've seen more recently have been less effective, actually. But I do think it is important that we keep these issues high profile and that we keep them in the papers.
Talking of which, what do you feel about the role of the media? Neil Cartwright says, how does the downplaying of climate change by some sectors of the media hinder efforts to address climate change?
I think I have been hugely disappointed by, actually, if we look at the ultra low emissions zone extension in London, that I feel that some of the press has played a hugely negative role in stirring up opposition to that really is quite unfounded. And as some people have pointed out, now it's come in, most people have found that their lives haven't changed very much at all. So I think there was a lot of that backlash. Well, I think some of that backlash was I think stirred up by some very biased press reporting.
Yes. So I'm not sure which way to take the conversation now, because I'm aware we've got only another 10 minutes or so. But there is an interesting question here. Stuart Lane's asking, it's quite a specific question about NHS trust risk registers. And on a practical note, climate change risks are challenging to map into NHS trust risk registers. That's a kind of, I can imagine the people trying to kind of produce a risk register for an NHS Foundation Trust must be an enormously complicated thing. And how do you map the adaptation risks into that? And I guess that requires a great deal of expertise. And Stuart says one can make a case for a very high severity and a very high probability score, but risk managers can take a different view and keep risk at a much more modest level, or not on the risk register at all.
And it's a challenging one, and of course it will depend on where trusts are located and things like that. When it's clearly, if you're in a flood zone, if you're at the coast, there will be some obvious flood risk scenarios that need to be taken into account in your risk register. Obviously, if you're if you're near an airport or a port of entry to the UK, there will be some obvious areas around the bringing in of impacts of climate change overseas, and people coming from those countries who might be bringing new risks into the UK. If you're in the southeast, or around where I am in East Anglia, I would think you definitely would have drought on your risk register, because the pressure on water supplies in this part of the country is going to get more and more severe. So it's sort of location dependent, and it's sort of understanding more and more of the information from the Met Office, where they're beginning to be able to get more and more specific in terms of quite small areas of the different types of weather impacts we're likely to see. So one of the places that I would certainly go for advice is the Met Office, because that kind of localization of information. And I know that the Met Office are looking to provide interactive information to tell you about weather and climate risk locally.
Yes, very good. Thank you. Bringing this to a bit of a close now, but a key question for the community that we represent of health professionals. What can or should the health community be doing now to support the work of the Adaptation Committee or the Climate Change Committee more generally? There's some very eloquent and expert and articulate and trusted voices. People, I think, want to do more and often don't know what to do.
Well, I think certainly that point about risk registers is a very good one. Making sure that the risk is being taken into account in risk registers for hospitals and for trusts, and therefore making sure that those increasing levels of risk are being fed up into the NHS and the Department of Health, so that it starts to be on their agenda of thinking, how do we get funding for this? But I think the other thing that's quite important is thinking about the cost of climate change on the NHS. I mean, one of the things we need to do, you asked very sensibly the question of where is the funding going to come from to do some of these things. Well, the costs to the NHS, the data I have in front of me, costs to the NHS of conditions exacerbated by poor housing is 1.4 to 2 billion per year in England. So if we can improve the quality of housing, so we improve the quality of people's indoor air quality, we improve the insulation so they don't get cold in the winter. In fact, I think we heard on radio this morning that there had been some funding from BP which had been used for a very small scheme to pay the electricity bills of people from low-income backgrounds with particular kinds of chest complaints and things, and that had reduced their use of the health service and the number of visits they made to GPs and things. If we can capture this sort of data and turn it into this could save the health service money, then we start to have a business case to drive the government to do some of these things, or indeed to get, you know, to get people to invest or to co-invest to make some of these adaptations and indeed mitigation actions happen.
Mm. And I mean, is there a route for channeling that kind of information that we should be aware of? I mean, obviously publishing it, and you know, people are doing studies of that sort, and those data do exist, and we need to have more. I would imagine. But what would be the route in terms of making political headway? What do you see? What is the most impactful way that health professionals or health researchers can make their case for that economic argument, if that's the right word?
Well, I mean, if people have data, we'd love to see it on the Climate Change Committee. And I think for, you know, academics, as you say, to be putting in grant applications and generating more data of that sort and making sure it gets published is always useful. I think highlighting it to MPs and politicians that that these things. I think there was a report I heard on the radio the other day. Was it that that was that the Office for National? No, it wasn't the Office for National Statistics. Was it the Office for Budget Responsibility had done an assessment pointing out how much more expensive it would be if we didn't address climate change than if we did. And it's things that can contribute to that kind of assessment, to make it clear to politicians that making these investments actually has a good return. Because the problem is you can't always see where the return comes. No. And the health system must be where quite a lot of the return from adaptation investments comes.
Yes. Rosa Foster expresses the frustration that I think perhaps you and I and all of us will share, but in a specific way, which is about the lack of clarity about the roles and responsibilities for strong climate action. And might the Climate Change Committee help to clarify that? She says it is very challenging to determine who is accountable for what and what responsibilities are shared and how they should be shared. This lack of clarity is incredibly damaging. It creates a lot of inertia.
I think you're absolutely right. And again, that's one of the challenges of adaptation being a DEFRA responsibility, because actually many of the things we need to do are nothing to do with DEFRA, but because it's seen as an environmental issue, it's a DEFRA responsibility at government level. And so I think it means that it doesn't put enough pressure on the government departments who need to take action. So, you know, for me, the Department for Levelling Up Communities and Housing and Communities, it's hard to keep catching up with its name changes, is actually where many of the requirements really fall. But DEFRA is having to be the conduit to put pressure on them, and that to me is not working. So I would absolutely agree, and we do on the Climate Change Committee try and finger the individual government departments or the regulators or who the individual groups are that we think are the people who need to be taking action.
Very good. We're going to call it a day there. Julia King, Baroness Brown, thank you so much for joining us for this conversation. We really appreciate your time and your expertise and your very you know, articulate and well-informed voice in this incredibly important area. Just to those of you,
thank you all for your interest in it, because it's really important, and so really appreciate that there is so much interest.
Well, absolutely, and very nice to know that there are channels that maybe we could pursue and try to keep open. I just wanted to let the participants know that this webinar will be available on the UK HAC website, the UK Health Alliance Climate Change website, and we're hoping it will be part of a series. So, Baroness Brown, you've started us off with a wonderful session. Thank you again very much indeed.
Thank you.
Thank you.